Administrative assistants B. Dietary technicians C. Clinical professionals D. Medical students. Based on the provided training material. The Inter-RAILTCF form is primarily designed for use by A. Administrative assistants B. Dietary technicians C. Clinical professionals D. Medical students. Based on the provided training materials, the correct answer is C. Clinical professionals. The Inter-RAILTCF is defined as a standardized clinical assessment tool designed to capture a person's cognition, function, mood, and health conditions. The materials emphasize that the data collected is specifically used by health professionals and clinicians to develop care plans, prioritize needs, and identify residents at risk. Page 9, Slide 1 to 2, page 164, Slide 1 to 2, 154-170 Doc 030920309202621475.pdf page 165. Slide 223-41 Doc 030926-0309202621174.pdf When is routine assessment due after first assessment? 2. Routine reassessment timing, scheduled at regular intervals, example quarterly or annually, depending on jurisdiction and policy. In Ontario, it is at least quarterly. Details: detects gradual changes in health or function. Validates or adjusts care strategies. Supports quality measurement over time. Routine assessment: a resident is admitted into your home on January 1, 2025. Their ARD date is January 4, 2025. Routine assessment should be scheduled 3 months later, April 4, 2025, could be up to 92 days equals April 6. Page 26, page 54 for coding 53-56 Doc 030926-0309202621243one.pdf page 297 of 292-318 Doc 030926-0309202622160.pdf How should you code when a person cannot recall short-term information after 5 minutes? A0. Memory OK. B1, memory problem. C2, unable to assess. D3, not applicable based on the Canadian LTCF credentialing manual. The correct answer is B1, memory problem. According to the specific coding instructions for section C2, memory/recall ability, the ability to recall short-term information is coded using the following scale: 0 equals yes, memory OK. 1 equals memory problem. If a person cannot recall information after 5 minutes, their short-term memory is not OK, and it must be coded as 1 to indicate a memory problem. Page 2523-41 Doc 030926-0309202621174.pdf What is the primary purpose of the assessment? Reference date, ARD. A. To determine the person's birth date. B. To document discharge status. C. To establish a common reference point for observation and coding. D. To record when the form was printed based on the provided Inter-RAILTCF training materials. The correct answer is C. To establish a common reference point for observation and coding. The assessment reference date, ARD, serves as the specific endpoint for the assessment's look-back periods, such as the standard 3-day look-back period. This ensures that all observations, information gathering, and coding are based on the exact same time frame for the person being assessed. Page 5453-56 Doc 030926-0309202621243one.pdf Procedural memory is assessed by determining if the person can follow a sequence of tasks. True or false? True. Based on the Inter-RAILTCF coding guidelines for Section C, cognition, procedural memory is assessed by determining if the person can perform all or almost all steps in a multitask sequence without cues. Page 33-34-23-41 Doc 030926-0309202621174.pdf For a resident discharged before a first assessment is complete, which sections must at minimum be completed? A, B, R, S, B. A, C, G, J, C. All sections. D. None. The correct answer is A. A, B, R, S. According to the discharge timing and assessment rules, if a person is discharged before the full assessment is completed, you must add a minimum complete sections A, identification information, B, intake and initial history, R, discharge, and S, assessment information. Any other data that has already been collected should be saved, and the last day of stay must fall within the 3-day assessment window ending on the assessment reference date, ARD. False page 296-292-318 Doc 030926-0309202622160.pdf page 36, slide 123-41 Doc 030926-0309202621174.pdf page 53, slide 253-56 Doc 030926-03092026212412431.pdf It is acceptable to use family input as the only source for cognitive function if the person cannot respond. True or false? False. Based on the Inter-RAILTCF credentialing materials, it is not acceptable to use family input as the only source for cognitive function if a person cannot respond. There are two primary reasons for this based on the coding guidelines. 1. If the person is completely non-responsive, example in a coma, you must code item C1, cognitive skills for daily decision making, as 5, no discernible consciousness, coma. When a person receives this code, the instructions explicitly state to skip the remainder of section C, cognition, entirely, as well as sections D, E, and F, and proceed directly to section G. You do not attempt to score their cognitive function using family input. 2. If the person is conscious but unable to communicate, the Inter-RAI assessment is designed to draw from a comprehensive mix of primary data sources. While primary support persons or family are important sources, assessors are also required to use direct observation, interviews with direct care staff, and medical record reviews. Furthermore, specific guidelines within the cognition section state that accurate assessment requires conversations with staff, family, or others who have direct knowledge of the person's behavior, indicating that multiple sources should be consulted rather than relying solely on the family. Page 98, Slide 1 Section 12, Other disease diagnoses. A. Is optional and has no impact on any outcomes. B. Is mandatory and has an impact on some outcomes. C. Is mandatory and has no impact on any outcomes. D. Is optional and can have some impact on outcomes. E. None of the above based on the provided Canadian LTCF credentialing manual. The correct answer is B. Is mandatory and has an impact on some outcomes. Note, your query refers to Section 12, which appears to be a typo for Section I2, Other disease diagnoses. 108 Doc 030926-030920262133448.pdf Here is the breakdown of why this is the correct choice. It is mandatory, unlike certain other sections in the manual that are explicitly marked as optional, such as Section N1, List of all medications, or Section P, Responsibility and directives. Section I2 contains no such label, meaning it is a mandatory part of the assessment to complete. It impacts outcomes. The manual uses a specific legend where Q means an item impacts quality indicators, CHIs, and R means an item impacts resource utilization groups, RUGs. In Section I2, specific diagnoses are marked with these impact symbols. Quality indicators, CHIs. Huntington's disease, item I2A, is marked with AQ. It acts as an exclusion factor for the CHI that tracks residents on antipsychotics without a diagnosis of psychosis, DRG01. Resource utilization groups, RUG. Cerebral palsy, item I2B, and septicemia, item I2C, are marked with an R. Their documented ICD-10-CA codes are directly used to qualify a person for the special care or clinically complex RUG 3+ funding classification groups. Page 36, Slide 2 The ARD represents A. Date of hospital admission. B. Start of a residence stay. C. Endpoint of the observation period. D. Date of last CIHI submission. Based on the provided inter-RAILTCF materials and our previous conversation, the correct answer is C. Endpoint of the observation period. The assessment reference date, ARD, serves as the specific endpoint for the assessment's observation or look-back periods, such as the standard 3-day look-back period. This ensures that all observations, information gathering, and coding are based on a standardized time frame. 23-41 Doc 030926-030920262117444.pdf. The best approach to verify short-term memory is to ask the person what they did 5 years ago. Ask the person to remember 3 words and recall them after 5 minutes. Ask them to name the Prime Minister. Ask them to count backwards. Page 54, slide 153-56 Doc 030926-03092026212412431.pdf. The correct approach is to ask the person to remember 3 words and recall them after 5 minutes. According to the Inter-RAILTCF assessment guidelines for cognition, short-term memory is specifically evaluated by determining if the person seems/appears to recall after 5 minutes. The other options provided assess different cognitive functions. Asking what they did 5 years ago evaluates long-term memory, recalling the distant past, while naming the Prime Minister or counting backwards assesses general knowledge and concentration, which are not the criteria for short-term memory.